I've been very troubled to hear of reports, one as recently as at lunchtime today, of people treating our Chinese-Canadian community differently. That they in some way are being or should be shunned or quarantined or suggesting Chinese businesses should be avoided.
We are facing an emergency, not necessarily in a public health sense, but an emergency within the Chinese-Canadian communities because we are being singled out, we are being stigmatized because of the coronavirus.
We know that with a new disease, a new emerging infectious disease, there are uncertainties around the situation and many questions that people have. Unfortunately, though, what we are also seeing, despite the best efforts of public health officials, myself and my colleagues around the province and around the country, despite the efforts that we're putting out there to ensure that people are getting information, accurate and credible information, we know that inaccurate information, misinformation continues to spread, and this is creating unnecessary stigma against members of our community. And you've already heard many colleagues here speak of that and the negative consequences associated with that. As a public health professional, I have to tell you that this is deeply concerning, and it is truly disappointing in our city to see this happening. Discrimination is simply not acceptable. And from a public health perspective, as we seek to address the situation with a novel coronavirus, it is unhelpful to have misinformation spreading. And frankly, it does not offer any protection. It's quite counterproductive. So at Toronto Public Health, and with other public health agencies all around the world, we are seeking to put out credible information so that people know what they can do, they can inform themselves and find out what they can do to best understand the situation and take whatever precautions are necessary. However, I would advise you, again, it is cold and flu season. The best protective measures are the ones that we have routinely offered and advise people to follow. And you've heard many of those many times, but they do bear repeating. Wash your hands. Wash your hands with soap and water. If soap and water is not accessible, please use an alcohol-based hand sanitizer. Cough or sneeze into your sleeve or cover your cough or sneeze. If you don't have a tissue, absolutely use your sleeve. We also advise that people should stay home when they're ill. This is the best thing you can do for your own health and to prevent the spread of disease.